Well, good afternoon. Marvin Music here with MedicareSchool.com, and I want to welcome you to our live event through our YouTube channel subscribers, as well as those of you that are part of our Facebook group. We're glad you've joined in. I know people are coming in right now, so I just want to say a couple of preliminary things. Also appreciate your flexibility on timing. Normally we do these at 5 o'clock Central Time. But due to some schedule conflicts, this is the time that worked best for me, so I'm glad it's worked out for you as well. I do want to mention as we get started here that if you have any questions, you can actually begin putting those in the chat right now. I will stick around as long as I can. I have about somewhere between about an hour and 15 minutes to an hour and a half to be with you, so we'll answer as many questions as we can. Do me a favor as you put your questions in the chat. I know people try to be brief, which I understand, but don't be so brief where we can't understand your question. Sometimes that happens, so make sure we can truly understand what you're trying to communicate, because we do want to help you as much as possible. I do want to mention just two things. Number one, if you're unfamiliar with our YouTube channel, we would encourage you to go there sometime. It is MedicareSchool.com YouTube channel. We have well over 400 videos that I have personally produced, and some others on our team that would help you to really get all your questions answered about Medicare. We cover all kinds of Social Security topics as well, so I think you'll find that to be a wonderful resource for you as you seek to get educated. And then also those of you that are really looking just specifically for a good overview of just Medicare by itself, without real specific questions, but Medicare in general, go to our website, MedicareSchool.com, and I every year shoot a what we call an essentials workshop. It's a video. This year was about 50 minutes, but it truly will teach you all the ins and outs of Medicare. So avail yourself of that as well. 50 minutes, well worth your time. We'll really cover many things in that workshop that I think could be quite helpful. Okay, now if you're a client of ours or not, doesn't matter either one. If you let us know where you're from, we always like to know who it is that's joining in around the country, but we are glad that you're with us. I do want to talk about this particular topic here of always do this when you get an unexpected medical bill on Medicare. Now, before I really dive into the answer to that question, and I will, let's be real clear about when we go on Medicare, we have two options. And this matters because depending on how you decide to use your Medicare is going to be how I'm going to answer that particular question, because it is going to vary. So when you go on Medicare, those of you that are just really beginning that journey, you're going to realize that you really only have two choices of using, well, let me back up. You really have three choices when you decide to go on Medicare. The first choice, I almost, I'll leave out because it's a terrible choice, and that is to have Medicare A and B only. This is someone that just enrolled in Medicare A and B. They don't have a drug plan. They don't have any other insurance. And the reason that's a bad choice is because there's a lot of risk involved with that. There's too many gaps, too many financial gaps, liabilities in Medicare to do that. I would not do A and B only. Okay, so that's out. So it really boils down to two good options. They're different, and so let's be clear on what they are. Number one, you can choose to stay enrolled in original Medicare, that's A and B, and get a supplemental plan. Supplemental plans are also called Medigap policies. And if you go that direction, the answer to this question I'm going to address is different. The other option you have is to do what is called a C plan, or a replacement plan, an advantage plan. And you enroll in A and B, but now you are covered for your healthcare services under a private health insurance company's what they call managed care. So one is traditional Medicare with a supplemental plan. The other option is to use a Medicare Advantage plan. Now you're in a private health insurance company that really takes care of everything for you as far as management goes. Okay, so those are the two systems. All right, now let's talk about a couple differences, and then I'm going to answer this specific question. So number one, if you decide to get a supplemental plan, when it comes to providers, you almost have unlimited choices, folks, almost unlimited. As long as your provider, hospital, doctor, specialist, surgeon, whoever you go to, takes original Medicare, they will take any supplemental plan that you're on. The company you choose, the plan you choose. Okay, so you can go anywhere you want almost. 99% of all doctors take original Medicare. So that's when it comes to providers with supplemental plans, almost unlimited. Now, if you decide to get an Advantage plan, it's not going to be unlimited providers. In fact, it's going to be limited providers, because the way Advantage plans work is that private health insurance company that just replaced Medicare for you, the first thing they do is put together a network of providers, and they enter into a contract together to take care of you. Primary care doctors, specialists, durable medical equipment providers, pharmacists, so all kinds of different providers. And so Advantage plans are network-based coverage. And that means that you're either going to be an HMO or a PPO. And with all those come rules. I'm not going to get into all that because that's not our main topic. But you have to decide going into this, do you want a network? Are you all right with an HMO or a PPO? If you're not, you ought to go with a supplemental plan because it's open access. Now, if you say, I'm fine with networks, then that's all right. Advantage may be a good option for you. Okay, let's keep going. Now, not only will there be a difference in providers, but also a difference in who's going to manage that care. And the way that private health insurance companies will manage the care is they will attach to about 70% of the services you need a pre-authorization, which means just because your doctor says you need a knee replacement, hip replacement, you need extended stay in a skilled nursing facility, you need to have this surgery, that MRI, that CAT scan, just because doctor says you need that doesn't necessarily mean you're going to get that. Now, you may and probably will, but you may not. Why? Because with Advantage plans, they have pre-authorization, the final say-so for the healthcare services that you're going to get. And they may change. A doc may say you need a full hip replacement. Advantage plan says, no, we'll pay for a rod, and that's it. That's all you get. And so if you take an Advantage, you got to realize that just comes in that system. It's something you just have to live with. And if you don't want that, then you better get a supplemental plan. Why? Because supplemental plans could never put a pre-authorization on any service. If Medicare says they'll cover it, doctor says you need it, you get it. Insurance company has no way to interfere, can't delay, can't deny you're going to get that service. And my whole point is, as we answer today's question, you have to decide how are you going to use your insurance. If you want networks, that's Advantage. If you don't want a network, better get a supplemental plan. Pre-authorizations, again, that's going to be Advantage plans. No pre-authorization is going to be with your supplemental plans. Thirdly, the policy type. If you get an Advantage plan, it's for 1 year only. That's it. It's an agreement for an annual agreement between Medicare, insurance company, and you. Supplemental plans are lifetime agreements. You have a lifetime plan that can never be canceled by the insurance company other than non-payment premium. And then there's some additional rules that are going to go along with that. And that is that if you're on an Advantage plan, it's not only an annual agreement, but it's tied to a service area. It's tied to a local area. A supplemental plan it's a national plan. I mean, anywhere you go, the coverage is going to be the same. Again, you're going to have to decide, what are you comfortable with? So many people mistakenly think the big issue is monthly premium, and it's not. A monthly premium matters for sure. We all have to live within our means, but monthly premium is not the end of the story. What matters is how is your insurance going to work? And so that's why I'm sharing this with you. So you have to realize that when you take one of these other plans, there are going to be some issues that are going to come along with it. Now, when it comes to Advantage plans, they have lots of perks. Supplemental plans do not. Advantage plans will throw in a dental benefit. Sometimes it's good, sometimes it's mediocre. They'll throw in hearing aids, maybe some additional vision benefit for eyewear. They may give you a gym membership. So that's what Advantage plans do. What supplemental plans do is they focus on premium quality insurance. Not a lot of perks, not a lot of bells and whistles, but if you have a serious health problem, you'll be very glad that you didn't have a pre-authorization, that you could go almost anywhere you want to get that health care service. So the point is, ask those kind of questions. How is your insurance going to work? Okay, now let's get to the topic. The other difference they have is how you pay for them. If you have a supplemental plan, what is happening is you go to the doctor and you give that doctor or the hospital, the specialist, the surgeon, whoever's going to take care of your healthcare services, you actually give them two cards. You give them your A and B card, and you give them your supplemental card. Now, quick education about supplemental plans. Right now, the top two plans in the country are Plan G and Plan N. Now, some of you may have an F plan because you started Medicare before 1/1/2020. I would suggest, if you can medically qualify, to get off that F and go to a G or an N plan. It's just a smart move. You save a lot of money. You'll have more stable rates for the long haul. But the point is, right now, the top two plans, G and N. The G plan covers 5 of the 6 Medicare gaps. The N plan covers 4 of the 6 Medicare gaps and has some copays along with it. But here's my point. If you're in traditional original Medicare and you have a supplemental plan, you go to any provider and all you do is give them cards. You do not give them any money out of your pocket in that system, okay? And so the reason for that is because when a doctor takes Medicare, they're obligated to bill Medicare first. That's the way it works. They can't charge you for billing Medicare. They have to do all the paperwork, and they file that claim with Medicare, and Medicare pays its part. And then what Medicare didn't pay will automatically go to your supplemental plan. And if you have a G plan, what is going to happen is that supplemental company will cover all the gaps that Medicare did not cover except for one, and that's called the Medicare B deductible. Once a year on the G plan, you've got to meet the B deductible. This year, that's $257, and it's once a year. Last year, it was $240. And so that $257 is your responsibility. So let's say that your very first claim, you get an MRI and you get a bill for $257. Why are you getting that bill? Because you have to meet your B deductible. And then after you've met that B deductible once a year, then you should never get another bill. And if you do, you should not pay it. There's some kind of a problem. So my point is, if you're on a G plan and you get a bill, it's all right for the first $257 because that is the Medicare B deductible. But after that, don't pay it. So why do people continue to get bills even beyond that? Because many times what we have is a coding problem. Coding, C-O-D-I-N-G, coding. Everything has to be coded properly for Medicare to cover. But as long as the provider, the doc, the specialist, the surgeon, the hospital coded everything correctly, and you're on a G plan, you should never get any bills for the whole year beyond $257. All right? And so if the bill comes unexpectedly, first thing you have to ask yourself, have I met my deductible yet? And if you haven't, then pay the bill. And that first $257 could be maybe your first it was a doctor visit for $80. Well, then pay that. It could be some lab work. You owe $40 for that. Whatever. But the first $257 will be out of your pocket. After that, nothing. So what would you do in that situation? Well, if you got a bill that you're having problems with, if you're our client, call us. And we'll get the insurance company on the phone. We'll do a 3-way call, and we'll find out what's going on. And they'll normally say, Medicare didn't pay that because it was not coded correctly. And so what do we do then? We got to call the provider, let them know. Wasn't coded correctly, correct the codes. Here's what you need to be using, and the problem will be resolved. Okay, now, let's say that you have original Medicare and you have a supplemental plan in. The way it works is this. In will not cover the B deductible, just like I said on the G. You've got to meet the first $257, and then N will not pay excess charges. And so an excess charge, number one, is very rare. Less than 5% of doctors will charge excess, but when it happens, what happens is that they added 15% to the bill. It does happen, it's rare, but when it happens and you have an N plan, you would have to pay that. So if you're on an N plan, you get an unexpected bill. It could have been that you went to a provider that actually adds excess. And so that's the first thing you have to find out. Now, a doctor usually doesn't add excess because they're under a contract called a participating provider, also called an assignment contract, where they can't add to the bill. And again, usually they don't. But if they do, you would have to pay that out of your pocket if you have an N plan. It's an additional 15%. Now, beyond the excess charges and the B deductible, N also carries some copays. They're very reasonable copays. Any kind of doctor visit could have a copay up to $20. So if you have already met your B deductible on the N plan, remember the G, that's all you pay. But on the N, you get a bill beyond the $257. Don't be shocked, it could be up to $20. Now, it could be a copay of $12 or $18, never more than $20. So then, of course, you would pay that. But if it's higher, again, don't pay it. Don't do that. Call the provider. If you're our client, call us, and we'll work through that to figure out exactly what happens in that scenario. All right? So my whole point is that in the traditional original Medicare with supplemental plans, just know you don't pay anything of the doctor. There's nothing out of pocket. That's got to go to Medicare first, your supplemental plan second. You could have a balance of the bill to meet a deductible or a deductible plus copays if indeed you're on an N plan, maybe excess charges. All right. Okay, so that's that system. Now let's talk about what half of all Americans are doing today, and that is Advantage plans. Again, these are C plans, replacement plans they're also called. And so the way they work is this. you're enrolled in Medicare A and B. You have to pay your B premium just like you would if you have a supplemental plan. This year, for most people, that's $185 a month. And so you go to the doctor and you have an Advantage plan, you are not going to use your A and B card. Why? Because you have a replacement plan. You're still enrolled in Medicare, but you came under the umbrella of a private health insurance company's managed care plan with networks, pre-authorizations, all those things I talked about. And so you are given one card for inpatient, outpatient, and prescription drugs. Okay, that one card takes care of everything. So the way these work is this. You normally don't have to pay a premium for an Advantage plan. And instead of paying a premium, like you would always on a supplemental plan, your out-of-pocket expenses will be copays. You're responsible for copays. You go to the doctor, it may cost you maybe zero copay up to $10 or $15, $20. Very, very low. You see a specialist, it's going to be somewhere between maybe $25 to $50 copay. You go to the hospital, it's going to cost you maybe $300 to $400 a day up to a certain limit, usually 6 or 7 days. All right, you have an MRI, it's going to cost you $250 copay. Outpatient surgery, $400 copay. And so the point is, on Advantage plans, you have copays. And so you pay those when you go to get that service. Okay, so if you go to the doctor, as a specialist that has a $30 copay, you're going to write a check or whatever, pay with a credit card, $30 at the doc's office. And if you get any bill beyond that, don't pay it. Because what should happen in that scenario is you pay your copay that's scheduled in your Advantage plan, and the balance of that has to go to your Advantage company, and they're responsible for the difference. So if you had an MRI and it cost $250 copay, you're going to have to pay that at the diagnostic imaging office. You got to pay that up front. And so the point is then after you've met that, then they're going to bill the balance to the Advantage company. So if you ever get a bill beyond your responsible scheduled copay on Advantage plan, again, don't pay it. If we set it up for you, call us. Let's figure out why are you getting that bill. And just sometimes, things happen. Billing department's not perfect. But what I'm saying is on the Advantage plan, it's copay at the provider's office up to a certain limit. And that limit varies. HMOs this year, PPOs vary. HMOs about $3,000 to maybe $4,000 for the year total. PPOs somewhere between about $5,000, maybe $7,000, sometimes $10,000 if you've got a network. But it's a copay plan up to a certain limit. All right, and so again, other than copays, you shouldn't get any bills. And so my whole point sharing all this with you is if you do get a surprise bill, don't pay it. Let's figure out what was the reason for that. And again, on the supplemental side, original Medicare, it's normally coding. Over on the Advantage side, it's because maybe they didn't collect enough for your copay or didn't even collect it at all, and so you may get that. But remember, there will be a max out of pocket. So I just want to make sure you understand that the differences in these two systems. Advantage plans are pay-as-you-go. Supplemental plans, we pay a premium and we're pretty well done. Okay, and so both are fine. They're both good insurances. I just think what you have to decide is, do you want networks? Do you want pre-authorizations? Do you want an annual policy or a lifetime policy? So all those other variables, folks, matter when you make this decision as to how you want your Medicare to work. Okay, now you are dealing with an agent that has integrity if they will tell you about both of them. I get very frustrated in this business with agents that only want to talk about Advantage plans. Why? Because Advantage plans pay about a double commission. They pay lifetime residual. You stay on that plan, we get paid lifetime. It's not a lot, but it's a lifetime commission. So agents love it when people get Advantage plans. It's more profitable for the agent. But the question is, do you have better insurance? That's what matters to you. That's what matters to me. And that's what matters to agents who really care about people. It's all right. We write Advantage plans because sometimes that is the very best option for people. But we're not writing it because we're going to get paid more money. We're going to write that plan because it's in your best interest. And use it because you can't afford a little extra money on a monthly basis. You're comfortable with that. You're comfortable with networks. And that's a fine decision. But we want to make sure you understand both your options. Why is that? Because they carry consequences. You realize if you get on an Advantage plan, you stay on that plan a year or 3 or 5 or 7 or 10 years and ever want to get off of it, and you want to move back to traditional Medicare and get a supplemental plan, you have to medically qualify to do that. You got to go through underwriting to do that. And so there's health questions and health issues, pre-existing conditions that could keep you in the Advantage system for the rest of your life. I saw, as I was getting ready to come online here, I saw that question about the Advantage plan offered by an employer. And again, it may be a better plan than a traditional Advantage plan, but it still has the same rules. Still can't get off of without medically qualifying. Still have to deal with networks. Still have to deal with pre-authorizations. So it may be better than what the average person can get because it's through an employer, but you still have to live with the way that system works. And folks, I'm just saying to you, that's what matters. And a lot of agents that don't care will not tell you the ins and outs. Listen, there's advantages and disadvantages to all these plans. With supplemental plans, my only problem is a disadvantage would be you're going to have to pay for it. But some of you can afford a little extra and you want quality, premium, what I would say Cadillac insurance. That's going to be supplemental plan. Others of you said, I just can't afford that or I don't want to afford that. Well, then let's find the very best Advantage plan that we can. Okay, so enough of that. I hope that's helpful. Listen, you can check other things out on the website and our YouTube channel and learn more. So I'm going to call it quits on that. Let's now get into questions. Daniel, who's our producer, will be feeding me the questions, and we'll get going. All right, for my IRMA appeal, how can I get a status? All right, well, the first thing, if you filled out your IRMA paperwork properly, and by the way, those of you that are unfamiliar with this question, this is a gentleman that is considered to be high income by Medicare. When we go on Medicare, Medicare always looks back at our modified adjusted gross income 2 years prior. So if he's on Medicare, it sounds like he is 2025, they looked at 2023 modified adjusted gross income. Modified adjusted gross income is line 11 on your tax return plus line 2A. That is tax exempt interest is line 2A. Line 11 is your adjusted gross income. And so those two numbers together are reported to Medicare by the IRS every 2 years back, and they do this on an annual basis. So 2025, we looked at 2023. 2026, we'll look at 2024. And so this year will matter in 2027. That's just the way it works. And so what Medicare does is they set thresholds that says if you're above the thresholds, and those are for a single filer, $106,000 or above, you have an IRMA. This is what he's talking about, IRMA. It stands for Income-Related Monthly Adjustment Amount. This is a surcharge that high-income people have to pay. If you're a married couple filing a joint return, that number this year is $212,000 or above. Now, if I'm single filer below 106, don't have an IRMA. If I have married filing a joint return, I'm below 212,000 in 2023, I'm not going to have an IRMA. But if I'm above that, which is about 10% of the population, you're going to have additional charges. But what happens is, and this is what he's asking, can I find the status? So what he has done is he's asked for a reconsideration. We call that appealing the IRMA. We use a form called an SSA-44. And what we're doing in the appeal process is we're saying, don't look back at 2023. There could be one of 8 life-changing events, death, divorce, marriage, work stoppage, work reduction. There's a variety of them. And if we've had a life-changing event that we qualify, one of 8, then we can say, stop looking at 2023. I retired or semi-retired in 2024, 2025, and we can give them new numbers. That's appealing the IRMA so we can get those either eliminated or reduced. Okay, so, sir, answer your question. What you could do, the way I do it, I just call your local Social Security office because after you filled the SS-44 out, that's where the paperwork should have gone, to your local office. And you call them and ask them the status of that. I will tell you this, we normally hear within 2-3 weeks of approval. And as long as your paperwork was right, you filled it out correctly, you're within that time frame, a year or two of the life-changing event, you should win that. So call the local office and they'll tell you where you stand. Let's keep going. All righty, Juanita, can I submit a claim to Medicare and Medicare Advantage plans if I use a provider that does not accept Medicare but the service is covered by Medicare? No, you can't. In order for Medicare to pay, you have to go to a Medicare provider. Your provider that does not accept Medicare it has opted out, and that's exactly what it's called. They opted out, and they're actually supposed to disclose to you that they have opted out, and they will not bill Medicare, nor will Medicare pay them any money, nor even if you get that service and you submit that for reimbursement, I promise you, you're not going to get Medicare is not going to pay it. You have to go to Medicare providers, and you must get a service that's covered by Medicare for them to pay, or for the Advantage plans to pay as well. All right, good question, Juanita. Okay, Mary, turning 65 in April, I was told that I don't have to apply for Medicare A or B until I'm ready to retire. Is this true? I thought I was supposed to apply for Medicare A no matter if staying working. Okay, so first off, I want to address this issue about April. If you are still working, Mary, or your spouse is, either one. It sounds like you're still working. You are. If you're still working and you're covered by an employer-provided plan that has 20 people on the payroll, not on the plan. I don't care about the plan. 20 people or more on the payroll, then you don't have to do anything with Medicare A or B. A or B. Okay, so that is the one group of people, and only one group of people, that doesn't have to start Medicare at 65. So if you or your spouse are working, covered by group plan, 20 employees or more on the payroll, you don't have to do anything at all with Medicare A or B. Now, second question. I thought you were saying I was supposed to apply for Medicaid no matter if still working. Okay, that's not true. Now, the reason you've heard that, and by the way, that misinformation is repeated probably tens of thousands of times every single day, or at least thousands of times every day, because people have been told that even if you're going to keep working and you're in a large group plan, you have to at least take A, and if you don't take A, you'll be penalized down the road. And that's not true at all. Okay, now, I'm going to clarify something. There are people that could be penalized by not taking A at 65. There are some, but it is only 1% of the Medicare population. And that is that group of people, and again, 1%, that does not have 40 quarters paid into the Medicare tax system. We get 4 quarters a year. That means as long as we have paid in Medicare taxes, FICA taxes, self-employment taxes for at least 10 years, then we will get Medicare A at 0 premium for the rest of our life. And if Medicare A is 0 premium to you, no matter when you take it, you'll never pay a penalty. I promise. You won't pay a premium or a penalty. Okay? So now, if you don't have 40 quarters, we got a problem. But you probably do, as most people do. And so you're not going to be penalized for A. I promise you, you won't be. You can start it at 69. You can start it at 79. You can start at 150. It doesn't matter. If it's 0 premium, it's 0 for the rest of your life and no penalties. Okay? Now, I would take A, by the way, as long as I don't have or don't plan to contribute to a health savings account. Okay, so I encourage people, even if you're covered by a large group plan, don't have to take A or B. I would take A only, enroll in A only. There's no cost for it. I would take it unless I have an HSA. If you have a health savings account, not flexible spending, I'm just talking about HSAs. And if you have one of those, you know, and that means that you are having money taken out of your check, maybe your employer matches it or whatever, but you're putting money into an HSA, a little over $4,000 a year plus $1,000 catch-up. You can put a lot of money in the HSA. And if you have an HSA and want to keep contributing to the HSA, don't enroll into A only. Okay? Why? Because once you have any form of Medicare, A or B or both, you can put no new money into your HSA. So that's the group I would say don't enroll into A only. If you have an HSA, keep contributing to your HSA. But those of you that don't have an HSA, and maybe Mary doesn't, she's going to keep working, then I would enroll in A only. It's fine to do so. But you don't enroll into it because you're fearful you're going to get a penalty, because that's just simply not true. If it's free, it's always free. 40 quarters, that's the key. Let's keep going. All right. Is there a way to get the insulin paid as part of DME as well? We continue to pay out of pocket because we aren't sure what we are doing. Okay, yes. Now, you wouldn't call insulin DME. That DME, durable medical equipment, now for a diabetic, can be certainly diabetic supplies. It can be an insulin pump for sure. Okay, but insulin, if you are using a pump, can be paid through Medicare Part B. And I think that's probably what you're saying. But it's still not durable medical equipment. Now, DME is covered by B, but so is insulin that goes through the pump is also paid through B. So here's the key. What you have to do is you need to find a pharmacist that, and again, I'm assuming you're using a pump. So you have your prescription and you want to go to pharmacist where you find out that they will actually bill Medicare B for you, okay? Because all you should have to do, and I'm assuming you started Medicare after 1/1/2020, if you have a G plan or an N plan, all you have to do is meet your B deductible once a year. That's $257, and then after that, that insulin is going to be covered. Now, the nice thing about insulin right now is that it's not subject to the deductible. You only have to pay a $35 copay, but again, it's going to be billed through original Medicare and your supplemental plan. So again, just pay $35 is all they should charge you. Now the issue is you got to find a pharmacy, and they're out there that will bill it that way. What happens, a lot of people that are on insulin pumps and using insulin, they're wanting to get that covered through their Part D plan, and it doesn't work that way. Part D plans will cover the quick pins. That's someone that's not using a pump, and they'll cover those at a $35 copay. But if you're using a pump, it's going to be through B. And if you're getting insulin and it's not the pump, you're just using syringes, then that's going to be through, excuse me, your Part D plan, your drug plan. All right, and hopefully that helps. If not, call us, okay? And we can make sure that you're doing the right thing. But that's the way it works. So yes, insulin's covered in both B and D. B if it's going through a pump. D if you're just self-administering with needles, syringes, that kind of thing. Okay, $35 copay max either way. No deductibles. Okay, let's keep going. Okay, I'm from Connecticut, been on Medicare about 10 months. I'm on A and B and supplemental plan G. I'm single, still working, afraid I won't be able to afford the choice once I retire. Okay, well, that's interesting. So it sounds like you don't have any kind of a group plan, so you went ahead and went on Medicare. Okay, so Cheryl, here's a couple things that you could do if you are really worried about it. Stay right where you are, number one, until you do get ready to retire. You could, at that time, Cheryl, in Connecticut, I think you can move to an N plan with no underwriting. That would save you a little bit of money. And if money was really, really tight, then you can always go to an Advantage plan October 15th to December 7th. And that Advantage plan would start then January 1. So the point is, if you're concerned about this down the road, and it really does happen where your money tightens up so much, then you can always move to an Advantage plan. And frankly, that would be a good reason to do so. But right now, if you're focused on quality insurance and you can afford it, then I would keep that. If you want to save a little bit of money, maybe you can move to an N plan now. Yeah, I'm not sure exactly what you'll save in Connecticut. In most states, you save about $30 or $40 a month. And so that could be an option. But just know, people can always get an Advantage plan in your scenario, October 15th to December 7th. So that supplemental plan would be yours the full year. Make the decision October 15th, December 7th to move to Advantage, and then that new plan that would kick in January 1. All right, so those are your options. Okay, let's keep going. All right, can supplemental plans be terminated by the insurance company withdrawing from a given market? No, absolutely not at all. Now, that can happen if you're on an Advantage plan and they can pull the plan if they're going to leave a market. But supplemental plans are all written for life. So that is a lifetime plan. Even if that company stops writing business in that area, even if they stop writing business all over the country, it doesn't matter. They will continue to service that plan. I promise you they will. And I've seen it happen. It doesn't happen often, but companies pull from markets. They'll pull out of the market totally. But on supplemental plans, you just continue to pay your premium. You do. It cannot be canceled because they no longer want to do business in that area. I promise it will not happen. Let's keep going. All right, Minnesota does not offer a G plan. Does that mean that I can only get an Advantage plan in Minnesota? What are my options? No. What happens, Minnesota, Wisconsin, and Massachusetts are called waiver states. And so their rules for MedSup plans are different. Okay, however, what you can do, and we write them all the time, you can get a plan that's equivalent to a G plan or an N plan in Minnesota. Okay, just call our office. And what we do, we structure a supplement as a true supplemental plan. It's just not called the G plan. It's going to be called something else, and they'll add a rider to it. But I promise you, it's equivalent coverage to the G or equivalent coverage to the N plan. You can get it. Just call it something different. Why? Because years ago, Minnesota said we don't want to be underneath those 10 plans, those rules Medicare sets. We want to have some of our own distinct plans and rules, and those are called waiver states. All right, but you can still get a G plan. Promise you. Go. All right, Bill, I have a very good supplemental plan. My doctor ordered a blood test. I'm being billed because Medicare says it wasn't medically necessary. Okay. All righty. Well, that could happen. Now, the question is, if it wasn't medically necessary, why did your doctor order that? And if it was not medically necessary, then I don't know why your doctor did not disclose that to you, because they're supposed to. So I kind of bring this back to the doc. I don't think they did their job, because if they take Medicare, they have the responsibility to let you know when a service is not covered. Okay? So now you're asking, how do I get pre-authorized so I don't get a bill? Okay. Well, here's what I would do. And by the way, I rarely suggest people to call Medicare. Usually, I'd have you call us, go through the provider. But if you're trying to get some pre-authorization and your doctor is not able to talk to you about that, that's when I would call 1-800-Medicare. Call them direct and say, tell them your situation. And by the way, they'll be able to pull up that claim that went through that was not paid, and they'll tell you exactly what happened, and they may even be able to tell you what code should be used in your scenario. Okay, so that's what I would do, Bill. Call Medicare direct. All right, let's keep going. Under what circumstances can I use my Medicare supplemental plan outside the country? Example, if I go on vacation in Europe. All right, so here's the way it works. There's 6 of the 10 supplemental plans. F, G, and N are for sure in that list, but there's 6 of the 10. The other 4 I've never sold in my life, in my career. But what happens with 6 of the 10 Medicare supplemental plans, they include $50,000 in foreign travel emergency benefits. So if you're in Europe and you have a health problem, it's not because you want to go get a checkup. You're there because you're having a health issue. So here's what happens. If you're on an F, a G, and N, and by the way, and I'm sorry, I'm forgetting the other 3 letters that also cover these. Daniel, maybe you can look that up real quick and put them up on the screen. I don't think A or B does. I know that C does, D does, F, G does, and N does for sure. But the point is, if you have a supplemental plan that 99.9% of all people have, it's going to have a foreign travel emergency benefit. You're in Europe, you have a problem. So here's what happens. That foreign travel emergency benefit, number 1, it's a lifetime benefit of $50,000. So once the 50 grand's gone, it's gone forever. It's not replenished. So we have up to 50 grand for a claim. So here's the way they process the claim. They'll take that bill. In fact, let me just give you one. I had a lady that fell down some stairs, had an issue, not real big, but cost $9,000 in Australia. $9,000. That was the bill. Of course, Medicare doesn't cover anything. And so there, Daniel put it up there. C, D, F, G, M, and N. Good, thanks. $9,000 bill. You have to meet a deductible on this kind of claim. It's $250. So she had to pay $250. And now we have a balance of $8,750 left remaining. So with the balance, that supplemental plan pays 80% of the bill, and you will pay 20% of the bill. You meet the deductible on the claim, insurance 80, you pay 20. But remember, their 80% stops at 50 grand. So once they've spent 50 grand out of their pocket, then you would be 100% liable. And folks, that's why I tell people, if I'm traveling in Europe, anywhere outside the 50 U.S. states or U.S. territories, I would get some type of travel health insurance. Okay, get some good travel health insurance. Why? You can usually get those up to about $100,000 plus air evacuation, and that's the big cost. All right, let's keep going. Here they are. C, D, F, G, M, and N. Thanks, Daniel. Okay, by the way, big thanks to Josiah. Helped me enroll in Medicare A, B, D, and G. Also helped me with my IRMA appeal, and it was approved. Hey, that's great. Josiah is my son. I actually have 3 boys, 4 girls. And 2 of my 3 sons actually work at our company, Joshua and Josiah. And they're both a blessing. And it's really neat to be able to have your kids work with you. All right, my younger son is 15, so he's not in the business. I don't know if he will be. He likes the country. All right, let's keep going. In other words, he wants to be a farmer. All right, Daniel, I don't see any questions here. Here we go. William, what is the cost difference between N and G plans on average? I would say roughly $35 to $40. William, that's normal. But I will tell you this, there are some states where it's substantially more than that. Sometimes we'll see $75 or $100 difference. I think New York is huge. Florida's pretty good size as well, difference. But normally it's about 35 or 40. And folks, honestly, I think either one of those decisions is very good. We know that we're not going to see excess. This often, it's very rare, less than 5% of the time, right? So it doesn't happen a lot. There's 8 states where they can't even charge excess anyways. Those would be Connecticut, Pennsylvania, Ohio, Rhode Island, Vermont. Oh boy, I'm blanking. Man alive. I hate getting old. But anyways, there's 8 states where it's not even permissible for providers to add the excess. 8. Now the other 42 can for sure. So I'm not saying excess will never occur, because it still could. And I always just say, if you can afford the extra $35, $40 difference a month, then get a G. If you can't, you just feel like that's nothing you're comfortable with, and get an N plan. They're truly both wonderful plans. Go to any doctor still you want, no pre-authorizations, permanent policy, portable, on and on it goes. So all the benefits are the same. You just take on a little more risk on the N plan. But sometimes that risk is better. Right now, I'm reshopping all my insurances, home, autos, all that kind of stuff. Right now, I'm trying to save some money, lower my premium a little bit, and so I got to decide, what kind of deductible I want, and all this kind of stuff. So whatever you're comfortable with, but G and N are both very, very good. All right, let's keep going. Okay, can someone become a client of your company if they originally signed up with another broker? I tell you what, Lucinda, maybe. It just depends on what company you're with, meaning what insurance company you're with, and what kind of plan you have. But if you call in, and you can call the 800 number that's coming across the screen there, and the agents know which companies we can work with. It's called an agent of record change, and we'd be delighted to become your agent if we can. We'd be happy to do that. All right, let's keep going. Okay, how does copay protection work for Advantage plans? All right, Tiz. Here's the way it works. When someone has an Advantage plan, as I instructed earlier, those plans are pay as you go. You pay copays for the majority of your services. There's a few things that are zero copay, but most have a copay. And so what happens with a copay protection plan, depending on how you design it, you're buying an additional insurance policy, and by the way, it's usually about $30 to $40 a month. And what you're doing is you're getting that policy to offset some of your more expensive copays. Plus, most people get an additional cancer type insurance policy rider. So if they get cancer, they get a lump sum. All right, so that's how copay protections work. So if I go to the hospital and I have a copay protection plan, I'm not going to pay my copays. I'm going to be reimbursed for those by my copay protection plan insurance company. Could be an indemnity plan, could be critical illness plan, could be copay, whatever. It just means that you got additional insurance, again, $30 or $40 a month, and it'll help offset the expenses of expensive things, ambulance ride, hospital copays, cancer, if you got that, and you may max out because of all the cost of the treatment. So you're just getting additional insurance to cover those specific items, so it doesn't come out of your pocket. And I think they're smart. I really do. If I had an Advantage plan, I definitely would get one. Because if you don't have the $5,000 max out of pocket set aside, and you got cancer, I guarantee you're going to max out. And so that's the purpose. And by the way, they're called indemnity plans because when there's a claim that's paid, it's not paid to the provider. It's paid to you. They directly pay you, and then you can pay the bill. All right. Start Social Security in April. My wife is starting next month with her record already bound. Or beyond, okay, good. Her spousal benefit will be much higher. Will this automatically go up when mine starts? No, it will not. No, what happens, now she's eligible for sure. So you're going to start taking it in April. So what I would do is once you've started or once you've completed your filing, then she actually will have to call in. You cannot do this online. She'll call into your local Social Security office and let them know that she wants to switch her type of benefit. She's moving from her own retirement record over to spousal, and they can do that right over the phone for you. Now, you may not be able to do it on a live call. You may be able to call in and get an appointment, and they'll set up a time then to make that happen. And the one thing I'm not clear on is how far in advance you can do that. My gut feeling would be that as long as you have applied to say you want your benefits to start in April, then once you've gone through the application process, they'll know that, and then she can call in then and say, hey, when he starts taking his, I want to change my benefit from my own retirement to spousal, and they'll make that happen. All right, so the local Social Security office will do that. It's not automatic. It's no different than when someone is on a widower benefit and they want to take their own eventually. Again, you have to call them and let them know you're making that change. If I'm on my own retirement and then my spouse dies, again, I got to call them with a death certificate and let them know I'm switching the type of benefits. It does not happen automatically. All right. Okay, Advantage, can I get Medigap? Yes, you can. Now, Karen, now I don't know for sure when you started Medicare, but there's a couple different rules here. Number one, if you're still within 6 months of your B date, your original B date, then you're still in a status where it's very easy to do. All right, got it? So first 6 months of your B date on your Medicare, very simple. Now, then there's 2 times the year you can do this. And that would be right now, January 1 to March 31. So if you're on a Advantage plan and you want to return back to traditional Medicare and get a supplemental plan, then you can do that. Now, keep this in mind. If you've been on that Advantage plan for longer than a year, you'll have to medically qualify unless you live in New York, Connecticut, Vermont, Maine, or Massachusetts. Okay, so again, as long as you're halfway healthy, then you can go to a Medigap policy at this time of the year and get a standalone drug plan. So that's very doable. But you have to have that done by March 31. And then if you don't, then you'll have another opportunity later this year, October 15th to December 7th. Those are the times that we can switch. So people that are already on Advantage and want to move to supplemental plans, if they're beyond 6 months of their B date, they're going to have to medically qualify, but they can do it. October 15th to December 7th, January 1 to March 31. All right, let's keep going. Okay, if I'm on a supplemental plan, can't afford to continue paying, can I switch to an Advantage plan anytime? No, you can't. No. Okay, so the way that works, if you're on a sub plan, the only time you take action and move to an Advantage would be October 15th through December 7th. Every year you can do it, but you'd have to do it during that 7 weeks. So Ronald, the plan that you're on right now is yours until the end of the year, okay, because it's annual. But if you do want to switch to Advantage, October 15th, you can start doing that through December 7th. And we can help facilitate that. And actually, we can put you in our records and give you a call back as we approach that period of time later this year and talk about your different Advantage options. All right, next. Does IRMA include pension and 401k distributions? Absolutely. And the reason it does is because IRMA is based upon your adjusted gross income plus tax-exempt interest. So when someone takes a 401k distribution or they have a pension income, all that is going into your adjusted gross income. So yes, it does. Everything is going to count. All right, next. I'm trying a high deductible G plan this year. Any concerns? You know, Tim, we rarely write high Gs. Am I saying that is, a crazy move? No. My only issue with high Gs, and by the way, I mean, we write so few of them. I think the deductible this year is what, $2,900, something like that. And so you really have, out of pocket, you're going to be, if you have any health problem, you're going to be out of pocket that $2,900 or $28, something like that. So that's one issue. So if you really had some serious health problems, the money you're saving right now between a regular G and a high G is going to be, swept away if you have any health problems that are ongoing. Number two, and this is the biggest concern I have, and that is that to get off of your high G plan, usually you have to medically qualify to do that. I know there's a couple companies where there's some exceptions. They'll give you a 2-year window where you don't have to do it. But most companies, you're going to have to medically qualify to move that. And so those are my concerns. Do I think that was crazy? No. We just find in our business, and we write on average about 2,500 new plans a month. There are just very few people that are willing to take on that risk. But if you are, Tim, hey, that's just fine. So I told you my concerns. Okay, could be lifetime. I know when people get sick, a lot of times at our age, there's, it's chronic. And so you have that condition, so that could keep you on that plan now for the rest of your life. So that'd be an issue. All right, let's keep going. I turned 65 March 14th. How do I know if I should take Medicare Advantage or Plan G? Well, the best thing to do, Deb, is to go to our website, medicareschool.com, and click on the workshop and watch that workshop. It's only 50 minutes. It is a great investment of your time. I've already talked a lot about this. So I don't think you've been on the whole time because I really have dealt with several issues. My main issue with the Medicare Advantage plan is I don't like network restrictions, and they always have them. I don't like pre-authorizations, and again, they always have them. And I don't like the fact that it's not a permanent policy. Okay, and I don't like the fact that if I get on it and my health changes, I can't get off of it. Okay, so if you can afford a G, I get a G. But hey, even if you can afford an N, get an N. Folks, listen, G and N are both great options. It just depends on that difference of that premium where you are. Okay, so if you can afford a supplemental plan, get it. People don't complain, folks. We don't get any complaints about supplemental plans. People love them. Why? Because they're high quality insurance. Now, they don't have a bunch of perks. You don't have a gym membership probably. Going to have your own dental plan, but it's a true dental plan at least. Most Advantage plans now are preventive only, and you usually have to find a network provider, and that can be real problematic. So the whole issue is Advantage plans are oversold. Agents push them because they pay us well. They push the zero premium. They push the perks, and that's what they want to talk about right out of the gate. I don't want to hear about all that. I want to hear about how's my insurance going to work if I get cancer. If my doctor says I need an MRI, does the insurance company have to agree with that? Advantage, yes. Supplemental plans, never. So again, you've got to find out how is your insurance going to work if you get sick and have a problem, because that's when you're going to find out, and it'll be too late then to switch. Okay, let's keep going, Daniel. I have had A and B and got a plan G with Medicare School, and I chose ACE for my plan G. I've paid my premiums, and I kind of figure out what my deductible is and when the plan G begins to pay. Okay, very good. Here's the way it works. It's very simple. JS. Medicare sets the B deductible every year. So last year, the B deductible was $240. Okay, and that meant if you had a G plan, the only thing you had to pay out of pocket for the whole year out of pocket was $240, the B deductible. Why? Because the G plan covers all the other gaps in Medicare. So there's one gap you pay, and that's only once a year, and that is the Medicare B deductible. Last year, $240. So you should have been out of pocket, max $240. Now, those deductibles reset every January. So now, once again, we got to meet our B deductible once a year. This year, it's $257. And so once you've paid the $257 out of pocket, and however that looks, it's anything on the B side, docs, lab work, outpatient services, outpatient surgery, durable medical equipment, everything covered by B, you have to pay the first $257 this year. After that, you're done. Okay? And by the way, you can call in. Call our customer service team. They ought to be able to walk you through that. And another way, call ACE because they have all those records. Remember, we can help you with a problem, but we don't know about your claims until you tell us about them. And so the whole point is, if you've had a claim and you have an issue, then you ought to be able to call ACE, and ACE will say, "Oh, that $60 bill went to your deductible, and you have to pay that." Remember, you got to pay the first this year, $257, and then you're done. But ACE should help you. We can help you. Be delighted to. But we'd have to get ACE on the phone to know exactly what claims you have. All right, Daniel, let's keep going. All right, I'm 65, still working, so I have insurance as a primary. I want to retire, have a spouse who is 60 with, I guess, CF is congestive heart failure, and 21-year-old child with type 1 diabetes. I'm afraid I can't retire. How do you handle this? Okay. All right. What I would do if I were you is I would have a spouse 60 with CF. Okay. Well, I would do this. If you want to call in, tell the agent your scenario. And then what we can do is we can, first off, we would have Affordable Care Act agent, ACA agent, reach out to you to find out what are your ACA options, your Affordable Care Act option plans, so that we can see if it is doable for you financially. I'm not sure how much money you make, but the income is going to matter to determine whether you can get a subsidy or not through the ACA. Because right now, there is no place to go as a general rule to get underage insurance unless you're working. So the marketplace is the place you have to go. So before I made this decision, thinking I can't retire, I would call, and again, we can refer you out. You can call the marketplace yourself and say, hey, I'm thinking about retiring. I'm eligible for Medicare, but here's my situation. I have my spouse, my child, and then let them find out, let them recommend what is available to you. And again, we have an internal organization that we use to help people with this. So if you want to call, we can do it. But that would be the first thing that I would do. Because you may find that you can get a decent subsidy and it may be very affordable for you. But I know you got to get them insurance for sure. So that's what I would do. The other thing you can do, and I don't think this is probably even an option for you, but if you go on Medicare while you're still working, then your dependents are actually eligible for COBRA for 36 months. Now you have to do that while you're still working, but because you're working when on Medicare, then COBRA, instead of being just 18 months, is extended to 36 months. But then you'd have to find out, what your COBRA insurance is going to cost. And many times it's very high. So that's why I'm saying I probably would start with an ACA plan first before I made this decision. All right. By the way, you call in, our agents can walk you through it. Barbara, what do I do if a doctor's office just tells me I have to pay them directly towards my deductible? Does that get messed up with Medicare? Well, I will tell you that that is not, they're not following the rules. Let me say it that way. Okay, Barbara? That it's not. So I don't think you're creating a problem for yourself, because here's what's going to happen. Let's say you've had no claims yet for the year, and you go to the doctor, and they've asked you to, give them $100 or whatever. So it's going on your account personally. So what's going to happen when that claim is filed with Medicare? Medicare is going to not pay the first $257. They're going to kick that bill over to your supplemental plan. If you have a G or N, they're not going to pay it either. Then that's going to then go to back to the provider to say, okay, you're going to bill your patient. This is applied to deductible. Well, you've already given some money towards that. So if they want some money, that's the way it's going to work. And again, I promise you, they are breaking the rules, because part of their contract as a participating physician is they are supposed to bill Medicare first. Medicare pays first, and then there can be a balance of the bill. So they're not following the rules. But if you like them and don't want to cause a big stink, I don't think you're going to get burned on that. I wouldn't give them too much, by the way. But that's the recourse. Let's keep going. All right, if I'm going to plan in and pay $20 for my first doctor visit in the current calendar year, does that $20 go towards my $257 deductible, seeing that I've not paid anything towards it yet? Okay, Carla, I would say to you, yes, but let me clarify something. Okay, what happens when Medicare files? The provider files a claim with Medicare, you're responsible for the first $257. Okay, and so you have to pay the first $257, and then after that, your cost sharing for doctor visits is up to $20. So what I'm saying is, I do believe that $257 is going to be kicked back, or let's say the bill's just $100, and you happen to give them $20, then that means that you're going to have a balance of $80, because until you've met that B deductible, you're responsible for the full amount. And I'm saying that $20 copay is due, but not until you've met your B deductible. Okay, so you pay the first $257, and then after that, every time you see a provider, is $20 each. They're trying to collect in advance, which is fine. I don't think you're going to get ripped off the $20, but again, that's not the way it's supposed to work. It just is not. You pay $257, then after that, you have cost sharing. Okay, the G plan, you meet the $257, and you have no cost sharing after that. That's the difference between the G and the N, plus N doesn't cover excess. All right, hope that didn't confuse you more. It's clear in my mind, but I don't know if it's clear in yours. Let's keep going, Daniel. All righty, I'm a federal employee, turned 65 in February. My full retirement age is 67 and 10. Okay, I will only have 5 years of service at that time. Okay, let's go back. First off, full retirement age, the highest right now is 67. So, yeah, so I'm not sure what the 10 means, but it's 67. I only have 5 years of service at that time. Will my Blue Cross standard still be a good idea, or should I just sign up for B and a plan G? Well, just depends on what your premium is going to be with your Blue Cross Blue Shield standard, and do you have other family members covered by that plan? We're finding a lot of people that don't have a lot of service with the federal government. their premiums are much higher than what it would be if they just got out of that system and went with original Medicare with the supplemental plan. Okay, so it really boils down to what's it cost you to keep the Fed plan. Yeah, and if it's, if you're paying $180, $200 or more a month, then get out of it. Just terminate your FEHB. There's a form that has to be filled out, and the premium starts coming out of your annuity, and just take traditional Medicare A and B and get a supplemental plan. Millions and millions and millions of people do that. All right, so what's nice sometimes, if someone has very low premiums and they have FEHB, then that sometimes works out. But it all boils down to cost. And so I just weigh the two side by side. And I'd say in your scenario, with no more than 5 years of service, going on Medicare and a supplemental plan should be a very, very good option for you. All right, let's keep going. Okay, I plan to work. Oh, sorry, Daniel, I missed that one. I plan to work until 70 or something. Okay, how would I handle? I went to dentist and my first Advantage plan paid for extractions. I had a flex card with $500 for dental that was used to help pay for my dentures, and the money was not applied. Okay, oh boy. Okay. Well, you're going to have to call your Advantage plan. That's all I can tell you. I'm sorry, Karen. I've never encountered that specific problem before, but you're going to have to find out from the Advantage plan why that claim was not paid as you expected. And just call them. They should give you a reasonable answer. If you're our client, call us, and we'll call them with you. If you're not our client, we can't help you. We can't service anyone but our clients. Okay, let's keep going, Daniel. I'm ready. All right, so I guess that's it. Thanks for watching. You see it there. We'll plan on seeing you, I think next week. It will be at our normal time, 5 o'clock. If we can help you, please call the number on the screen. Go to YouTube channel, join the Facebook group, and if we can serve as your broker, it'd be our privilege. Thanks so much. Take care.